For a lot of people, the struggle with COVID continues long after a negative test. As much as 30% will experience lingering symptoms for at least a month. Now, local researchers want to find out why. News 4's Lauren Daniels has the new information.
Since the very first infection, researchers have been working to understand the new coronavirus.
We've learned so much about COVID, but there's still so much to learn. In particular, this one is one of the more mysterious aspects of COVID.
Dr. Timothy Van Wagner with OU Health is one of several researchers across the country teaming up with the National Institutes of Health, looking at mysterious long hauler symptoms from loss of taste and smell to more severe complications with the heart and lungs. And that is not all.
Individuals develop sleep disorders. Other individuals develop some sort of neurological complications, including what some people refer to as brain fog, this inability to really think for long periods of time.
Researchers will analyze around 18,000 patients nationwide, 80 in Oklahoma, to try to better understand long COVID.
Whether this triggers some sort of autoimmune reaction in some individuals, or whether it's a reactivation of prior viral infections by viruses like Epstein-Barr virus.
Participants can range from those with long hauler symptoms to those who have never even had the virus. All who take part can help solve yet another one of COVID's mysteries.
Perhaps there may be some sort of antiviral that be given to them very early that will prevent whatever the trigger is that causes these long-term syndromes. It's, an interesting phenomenon.
Lauren Daniels, Oklahoma's News 4.
All right, Lauren, thank you. And while this study will focus on adults, there will be a future one for children.